It's Wednesday, December 18th, and this is the Daily Medical News, where we bring you clinical medicine's top stories, as well as a closer look at the day's biggest story. I'm Terry Rudd.
And I'm Molly Collegio. Today, why you need to watch for COPD symptoms in smokers younger than 50.
Atopic dermatitis in kids with food allergies could increase their anaphylaxis risk.
The Supreme Court hears a case that could put billions into the pockets of ACA insurers.
And how diabetes and insulin may boost patients' risks of bleeding and cardiovascular-related death.
And now, the news.
Using a new definition of early chronic obstructive pulmonary disease could mean more smokers younger than 50 meet COPD criteria. A Danish study using the definition revealed that 15% of Danish smokers under age 50 years who'd been exposed to at least 10 pack years had early COPD. The new definition defines early COPD as the ratio of forced expiratory volume to forced vital capacity being less than the lower limit of normal. It also includes the presence of abnormalities on a CT scan or decline in FEV1 that's accelerated relative to FVC. University of Copenhagen researchers analyzed data from more than 8,000 people younger than 50 with 10 or more pack years of tobacco exposure. 15% had early COPD, of whom 58% were current smokers. Those with early COPD were more likely to have chronic respiratory symptoms, severe lung function impairment, acute respirator hospitalization, and early mortality. The findings appear in the American Journal of Respiratory and Critical Care Medicine.
Children with atopic dermatitis and allergies to eggs and milk are at greater risk of anaphylactic reactions compared with allergic patients without atopic dermatitis. That's the primary finding from a retrospective review of data from nearly 350 pediatric patients conducted by researchers from National Jewish Health in Denver. The research appears in the Annals of Allergy, Asthma, and Immunology. The researchers identified children aged 0 to 18 years with peanut, cow's milk, and or egg allergies, with or without atopic dermatitis. Overall, children with egg and milk allergies plus AD had significantly higher rates of anaphylaxis than allergic children without AD. Anaphylaxis rates were similar in children with peanut allergies with or without AD. The researchers say their findings suggest skin barrier dysfunction has a role in food allergy severity, and clinicians should counsel patients and families about the potential for more severe reactions to oral food challenges.
The U.S. Supreme Court heard oral arguments in a case that centers on whether the federal government owes insurers billions based on an Affordable Care Act provision. Maine Community Health Options v. United States involves the ACA's Risk Corridor program. That program is designed to help health plans mitigate risk in the ACA's exchanges. It moves funds from profitable insurers to insurers with excessive losses. But collections from profitable insurers fell short in 2014, 2015, and 2016, and other insurers' losses steadily grew. That resulted in the feds paying about 12 cents on the dollar to money-losing insurers. More than 150 insurers now allege they were shortchanged, and they want the Supreme Court to force the government to reimburse them $12 billion. The U.S. Department of Justice counters that the government isn't required to pay the health plans. The agency argues that appropriations measures passed by Congress limit the funding available to compensate insurers for their losses. A Supreme Court decision is expected in early 2020. We'll be back with more medical news after this message.
Patients with diabetes may face a significantly greater risk of bleeding, cardiovascular-related death, and poorer net outcomes, particularly those treated with insulin. That's the takeaway from a sub-analysis of the ENGAGE AF-TIMI 48 trial. Researchers presented their findings at the World Congress on Insulin Resistance, Diabetes, and Cardiovascular Disease. The investigators noted that atrial fibrillation is associated with a 5-fold increased risk of stroke. Type 2 diabetes is associated with a 2-fold increased risk of stroke. And when AFib and type 2 coexist, thromboembolic risk rises even more. In the sub-analysis, 36% of the engaged trial patients had diabetes, most of whom didn't require insulin. The investigators found that the risk of stroke or systemic embolic events was similar between patients with and without diabetes. But patients with diabetes had a 29% greater adjusted risk of cardiovascular death than patients without diabetes. They also faced a 28% greater risk of major adverse cardiovascular events as well as of major bleed. Plus, they were 25% more likely to suffer the net outcome of stroke, systemic embolic events, major bleed, or all-cause death. The main ENGAGE trial showed that high-dose edoxaban cut the rates of stroke and systemic embolic events by 13% compared with warfarin. But the sub-analysis showed no significant advantage to edoxaban for patients with diabetes. Patients with diabetes who were treated with insulin were at a higher adjusted risk for all outcomes compared with those who weren't treated with insulin.
And that's it for today's Daily Medical News. Be sure to listen to the newest episode of the MD Edge Sitecast, available today and every Wednesday. For MD Edge, I'm Terry Rudd.
And I'm Molly Collegio. Thanks for listening.